Hi there. Welcome, welcome, welcome. I hope you're having an excellent Sunday as we have another conversation with Carla and just talk about different issues. So, let me introduce myself. My name is Carla, and I am your relationship doula, helping women and men bravely birth peace in the pieces of their lives. One of the things I love is I love helping people identify that thing in their life that is just really causing them concern and stress. But today we're going to have a conversation. If you've been following us on my stress management page or on my YouTube channel, Coach Carla Henry Lewis, you see we've had different conversations. And so this Sunday, I'm excited to have a special guest who happens to be my daughter, Rebekah Lewis. And we're having a conversation that some of you are having and feeling some stress about with if you're expecting, if you're a parent, if you're a new parent, with the different things that are happening currently with COVID-19 and all these other things. So, Rebekah, can you introduce yourself to the audience, please?
Hi, I'm Rebekah Lewis. I am a registered nurse and a certified lactation consultant, and I have been working on starting my own business as seeing patients outside and seeing them in their homes. So that is called Little Ones Lactation.
Okay, now little one lactations. Now, one of the things, as she mentioned, she is a registered nurse. You actually have a particular certification. What does that stand for? Those letters that I had there. Tell us what that is, please.
So IBCLC is a certification that you can receive. You do not have to be a nurse to be an IBCLC. It's an international certification, so it's for lactation, and they have three pathways which you can go about in pursuing this certification. You have to complete a certain amount of hours seeing patients personally, working with lactation and doing different kind of webinars to get that lactation education as well. And they have different ways. Sometimes some of them require you to take certain courses in order to pursue this certification, and you can look at which pathway works best for you to perceive that goal, and it's for anyone. So you don't have to have a degree, you don't have to be in the medical field. They have different pathways for those individuals that are interested in becoming lactation consultants and serving their communities, that they can become one. And it's a certification that you can use internationally, so all over the world.
I love that. Now, I want to find out from you what got you interested in being, because I know you're a mommy baby nurse and you're into skin to skin, you're into breastfeeding or encouraging moms to have the right and know what they can ask for when they're expecting a baby. Can you tell us some of the things, especially with COVID-19, where some places may or may not allow your partner there with you? What are some things that a new mom or someone who's just recently had a baby, what are some tips that you feel would be helpful that you would pass along?
So for your first question, how I got into this, as I work as a nurse, I started as a nurse working in the float pool. So eventually in my nursing career, I currently work and do mother baby couplet care. And when I first went into that area, I had a lactation consultant who she pushed me towards that avenue because she saw I had a passion and inspiration for helping moms with breastfeeding and being successful. And as a mother myself and breastfeeding my own child during that time, it helped streamline me into the field that I now work in.
Okay.
To the second question, for moms or that are in during this pandemic, the biggest thing is being your own advocate. It is hard due to limited visitors because of COVID-19. So you need to make sure you speak up and address things that you have concerns with. We all know that skin to skin is important for moms and babies. It helps with the transition process. And with the new studies that have been coming out, it's shown that breastfeeding help with providing antibodies and nutrition to babies and helping them to prevent them and reduce their chances of getting COVID-19. So as the research is coming out, they're showing that it does help babies being breastfed.
So what happens, or what can that mom says when she just had a baby and she may want to do skin to skin, and the nurse is going to take her baby? What can she what how can she speak up, or what can she say that will allow her to definitely use her rights?
So in doing that, I say communication is a big key. So a lot of times it's hard during those immediate moments, sometimes for moms to advocate for themselves, especially if they don't have a partner. If you're able to have somebody with you, them knowing your wishes and you communicating those to the staff ahead of the sensitive situation after you have your baby helps in addressing those issues so that during that time you're able to that and breastfeed your baby. Along with that, speaking up, you have the right to say no. You have the right to refuse. You do have the right to say, hey, this is not what I want. You have rights as a patient, as a mother, and as that person over your child. So you do have those rights to do that. And then I see Donna has a question, and yes, with adoption, you can breastfeed. It does take a lot of work and it does take some things that you may have to do to help with producing milk. You may not produce a full supplies. Some women do, but you are able to induce lactation in the process. If you wanted to breastfeed your adopted child, that is possible.
Oh, wow. I didn't know that. That was a great question. So it is possible for that. So I'm excited to hear that, because I know so many women who later on may choose to be adoptive parents, and they may not have been aware that they are able to breastfeed, but they need to have a lactation specialist to tell them how to go about doing that. That it may take a little while, but it's possible. I am so excited to hear that. Now, one of the other things I wanted to touch on as well, Rebecca, is I know many times when I know your passion for mother baby health, but you mentioned skin to skin. Tell them exactly, when you say skin to skin, what that means, please.
So skin to skin means that you're going to have your baby is going to be directly on your chest. So your upper torso is bare, naked. Dads can do skin to skin. It works a little bit differently in the sense of body mechanics. But with skin to skin, it means that the adult person's chest is naked, meaning nothing is on it. The baby usually will have a diaper on. You can do it without a diaper, but most parents put a diaper on just so that your baby doesn't pee or poop on you. But your baby should only have a diaper on and may have a hat right after birth as they're learning how to regulate their temp. But they're going to be in the middle of your torso, usually on you with their tummy facing you. So it's going to be like kind of tummy to tummy. And there you can turn their head to the side. And that way they're directly on your chest, because skin to skin works to help with your baby regulating their heart rate, their respirations, helps with their temperature, because mom's body or the person who put the child's body will warm up their body for their temperature to help that baby stabilize their temperature, along with they know your heartbeat better than anyone else. So that baby knows the birth person's heartbeat and is able to, it comforts them, soothes them, so they slow down their breathing. It helps because they're not stressed. It helps with regulating their blood sugar. So a lot of times you see less issues with blood sugar for babies who do skin to skin.
Oh, wow. That is wonderful. Now, Donna has another question, Rebecca, about latching
So
on.
depending on the issues with latching, there are different things that you can use. Some people use supplementary feeders, which have to deal with a tube that connects to a device that has milk in it. And you stream it so that way your baby's on your breast and is getting milk through the tube and is on your breast, which can help with inducing lactation and can help with getting your baby to stay at the breast because they're also receiving that milk through that device. And when they suck at the breast, they receive it that way. And that can work on that latch. Depending on other things, they can look at other issues that might be causing with the latch. So every birth person and baby are different. So depending on the direct issues, we can look at ways to help with fixing that latch.
And I think that is so important to understand because I know that even with your experience when you gave birth, there wasn't that much help for you initially when you showed an interest in you wanted to breastfeed and share with them your story, your frustration. What happened about your delivery?
Uh, my delivery was not the most as I say, you as a patient have the right to refuse and speak up for yourself. I was blessed enough to have my mother and my grandmother who were there to help be advocates for me and support me in my choices of laboring without an epidural, things like that. So they were there to advocate to help me. And in the process of, at that time, my child is now 7 years old. They were not doing skin to skin. I knew about skin to skin and I went to do skin to skin. That was not the facility's practice, but I spoke up for myself. And they all they could do was say, okay. And so I was able to do skin to skin, and my baby did latch very well at first. Later on, we had issues with latching, and I did not have support from a lactation person. And I do remember it was very hard, and I got frustrated and sent my mother to the store to buy a breast pump because I was determined to breastfeed. And no matter what I had to do, I was going to breastfeed my baby. And I still remember I had one nurse, and I do not recall her name at the moment, but she was able to help me. She saw me trying to open up this breast pump that I sent my mother to the store to purchase. And she's like, you don't need a breast pump. And I was like, well, we're having issues with latching my baby. And she helped me. And that night was probably the best night for my child and I. And because prior to that, we were struggling with feeding. So I know she was not getting the feeding she needed. Thankfully, we were very successful at working on those issues, but making sure you advocate for yourself. So in those times, I did not realize that I needed to ask to see a lactation consultant. And then at the point when I did ask, later on, after that nurse had helped me, unfortunately, it was the weekend, and at the facility I delivered at, they did not have anyone to help me. So it was just a work in progress. So much has changed in those 7 years. So a lot of facilities are making journeys along the baby friendly initiative. So they do have more support from staff outside of lactation consultants to be able to help you with breastfeeding, which is great to see the improvement made in that 7 years of time.
And because we're talking about breastfeeding and you, it's amazing. I know you see the disparities between the culture, and many times I remember years ago I worked with a group that did prenatal care because of the higher risk of deaths for women of color when they gave birth, and also because many of us had stopped breastfeeding for whatever reason. We bought into formula and thinking that breastfeeding is too hard, is too difficult, or we don't have enough milk. What do you say to moms like that who may feel, well, oh, you know what, I don't have enough milk, my baby won't get enough, and people tell me that, you know, I shouldn't breastfeed. What do you say to that kind of mom who wants to do it but is not getting the kind of support? Because before you continue, I remember when I breastfed my children, and it wasn't a popular thing when I was doing it. I got all kinds of flack from people as though this was the strangest thing. But I thought, number one, it's free, so why not do it? But it is challenging when you want to do something when it is not what people want to do. So go ahead.
So, like I said, a big thing that really got me into breastfeeding was, like my mom said, she did breastfeed. And a lot of people don't realize that due to many people not seeing people of their ethnicity or race breastfeeding, that does attribute to what your norms are. So, I saw my mother breastfeed, that pushed me into breastfeeding my child, and I was going to breastfeed my child and things along that line. When you hear many mothers say, I don't have enough milk, or their concerns, it's finding the root cause to their concerns of why they feel that they do not have enough milk, to help address those concerns, to help educate them. Sometimes it revolves demonstrating hand expressing so that they can see that they have enough milk, showing them how big their baby's tummy size is at that time, and different things along that line to help them with seeing that I do have enough milk. I am capable. Showing them the wet and dirty diapers are a big key to show that your baby is getting enough from you. Breaking those different stereotypes that have been perpetuated over the years, because many things have affected why we see lower numbers of Black mothers breastfeeding. Some of it has to do with having to be wet nurses for slave owners. Some of it has to do with the way formula companies marketed to low income families, things along that line, to say that they have brought us to this point. And just educating people about that. Just because you weren't breastfed or your parent doesn't mean that you can't do better. And just because you turned out right doesn't mean that you can't look at alternative options at feeding your baby, because you know better at this point and you want to do what's best for your baby and helping you achieve that goal. And then to answer about what Donna mentioned is breastfeeding does have lots of benefits. A lot of times when you breastfeed after the baby is born, the uterus, you will notice contracting, which helps with your uterus quickly. And it does lots of different benefits that you can get from breastfeeding. There's a list beyond that. You also, during that first 2 to 3 days, they have colostrum, which they call liquid gold, and it helps give your baby, it's basically kind of similar to like its first immunization. So that liquid gold gives your baby protection and antibodies and different things that you as in the birth person have acquired over your vast years of life. It helps protect your baby during this initial period of time where their immune system is still building and working to grow.
Hmm. I see that Therese says she breastfed all six of her children, and yes, people were not nice, but my mom was my support. Oh my, and I remember your mom. Love me, your mom, Therese.
Yeah.
So that is I like what I'm hearing because so often we have to change the narrative. People have told you that you
I
can't
agree.
breastfeed or that's something, but something I want to touch about with the breastfeeding with COVID-19. I know we've talked about it and you've mentioned, does that affect the mom's breast milk? So if she wants to still breastfeed with that, Rebekah, can you share what you've learned about that?
So the World Health Organization issues updates in regards to things and what they think is best. And their best and most current recommendation is that moms breastfeed their babies, because studies that they're working on, as this is a new virus that they're dealing with. So studies take time. So as the science comes out, based off of the information that's most recently come out, they say that your breast milk helps, like I said, gives your baby antibodies and protects them from different things. And they're showing that this is helping to protect babies and help them over. So they really recommend that you breastfeed your baby. You can also see that, and you'll have different mothers who may show their milk that they've pumped, and you can see the changes in their milk based off of different things. So that's how you know it's providing your baby breast milk depending on what their needs are for that time. And like Teresa said, I'm very proud of her for breastfeeding all her kids. Her mom was a very great advocate, and it is hard when you have a lot of people who are not supportive, and it takes a lot of work. And it's grateful to have people out there who can advocate for you and show support, because that's how you get more mothers to feel supported and breastfeeding. And
Yeah.
then I see that we have a question about bonding with your child and breastfeeding. Yes, a lot of times breastfeeding does help create bonds because of the psychological aspect in regards to breastfeeding, because your baby knows that you're meeting their needs and they're in that trust versus mistrust phase. So you want to try to establish that trust boundaries. So it does help in that aspect of with bonding with your baby. They know that you're going to meet your needs.
And that is so important because so many times in this day and age, we just want to put a bottle in a baby and just prop them up in the corner. And but the bottom line is with the breastfeeding and all of that, it is about touch. We're having this COVID-19 or social distancing. Studies have showed we are made for touch and for human touch. So could you imagine a baby that's been in your womb, in your uterus for 9 months, and all of a sudden you come and you just prop them up someplace? They are made for interaction, for companionship, for touch. And so breastfeeding allows the parent, the mom, or if they're pumping, and for the dad to take the time to stop and hold and bond, because that bonding is so important. So often they've had studies with kids in orphanage with detachment because they haven't been that physical and that bonding time. So that's why it is so important. And I'm just loving the questions and the comments that we're getting. And I see that Donna has says here, uh, promote, I produced enough milk to feed a third world country. Always drank a glass of water and 100% juice while breastfeeding. Okay, Becca, how about that being staying hydrated while you're breastfeeding?
The biggest thing is you do want to make sure you're staying hydrated. Doesn't matter what you're drinking. Make sure you're eating. Because one of the biggest myths many women feel is I have to eat healthy in order to breastfeed, and that can be a deterrent for them. But you just need to make sure you're staying hydrated, drinking fluids, eating foods. Yes, it's important to eat healthy foods, but don't let that be a determinant for you in regards to breastfeeding, that you can still breastfeed your baby regardless of that. You just want to make sure you are eating and drinking and different things along that line. And like my mom was saying, there are many studies that they show in regards to that. So it's important, because you have the stereotype that people are like, oh, don't spoil the baby. But the misconception is we are more, what do they call, carry mammals like kangaroos and other types of mammals. When you have many individuals who want to treat our babies like cats and dogs, because a lot of times they come out walking. Our babies do not come out walking. So they need time. So they need to be close to their food source, nurtured, bonding with. So a lot of times we have this concept of don't spoil your baby, don't hold your baby, when your baby's been held by you for a whole 9 months, or depending on how long you were pregnant. So they're used to that constant of being held, touched, and separating from that can be detrimental. So you want to make sure you're still bonding with them, regardless of if you're breastfeeding or not. When you're formula feeding, if you are, you want to make sure you're holding your baby, put down your other devices, focus on your baby, bond with them. That's their time to bond with you.
Oh, I love that. And so Donna says she refused to breastfeed in the bathroom. My breasts are beautiful, and so is breastfeeding. Excellent job, Rebecca. I
And the
love.
big thing with, like she said, is you can breastfeed. Like there's a law. So on all 50 states, you have the right to breastfeed where you're allowed to be, or where you're supposed to be with your baby. And the bathroom is not an acceptable place to feed your baby.
Oh, I love that, because nowadays too, they have so many nice, interesting ways that women can breastfeed, and it's not that obvious. Even though I could care less about that back in the day, I would be sitting in the back of the church, and my child had to nurse. I just discreetly just started nursing her, because it wasn't a whole big show. It was you just did something because they're hungry and doing that. So I'm excited because, yes, we're advocating for moms. If you choose to bottle feed, that's fine. If you choose to breastfeed, we just want you to know what your rights are as a mom nowadays, because it can be stressful not knowing. And that's one of the things that I just wanted to address for the moms and the parents out there, dads. Sometimes you may think, oh, the baby's crying too much or doing this. They just want your time, they want your attention. And it's okay to give them that attention, because, as Rebekah said, it's no such thing as spoiling a child. They're not fruit or vegetables that will spoil. They're there for you to just spend that time with them. Okay, so Becca, so we've covered about the skin to skin. We've touched a little bit about having that when they've had the baby. What kind of care? One of the things you did say is that, right, you don't have to eat perfectly to breastfeed. It's okay. If you eat horribly, it's okay. You could still breastfeed. But what are some of the things that um, if they're getting ready to give birth? Because one of the things I know about Rebekah, she just finished taking this course, and they talked about movement when it came to helping you have a better delivery. Because so often some women are fearful about what that's going to look like. But what was that class you just finished taking about a month ago?
Oh, so I'm working on providing dancing for birth classes, and the class my mom's talking about was a class to help teach people to instruct classes in regards to dancing for birth. And dancing for birth, they promote movement, dancing, fellowship. You kind of get to network with other moms in regards to dancing, different dances and things that you can do to help with movement during your pregnancy, during your labor, and even after birth with your baby, help with bonding with, like, you kind of have a mom circle. So the biggest thing, I think, we have the issue of a lot of people have lack of movement prior to delivery and sometimes when they go into labor. And we all know that studies show that gravity is your friend, and that there are different things you can do to help with bringing your baby down into the pelvis, with positioning, different like dance positions that we learned in this class that you can do in order to help with opening your pelvis, things like that, so you're comfortable, and different ways for those who may choose not to have an epidural and go unmedicated, ways for you to be comfortable in labor with movement, so that way you can be, a lot of times pain is the sign of something, so you're feeling discomfort, finding movement in positions where you're a little bit more comfortable. You may not get rid of all the pain, but you have yourself in a more comfortable position, so that way you are able to help with birthing your baby. So in this class we talked with different moms. It was different instructors learning around the world, talking about different things they did and how some of them would attend home births, water births. So different things and the ways that you can do these positions to help with opening up your pelvis, feeling more comfortable, and helping you birth however you're choosing to birth, and to make the experience so that way you are able to enjoy that experience of birthing your child.
Oh, I love that, because one of the other things there, and okay, so but Ruben has a question. Why is there a stigma against women breastfeeding their baby? I thought this was an acceptable practice.
Some of that I attribute to a lot of places in the US specifically have sexualized breastfeeding. So a lot of people attribute breast in a sexual manner when we were created with breasts to provide nutrients to our babies. So that's their main purpose. But some people have attributed to that. So people see them as sexual objects instead of, oh, she's feeding her baby. That's normal. Other places around the world, outside of the US, most of them see breastfeeding as a normal stigma. Many studies show that foreigners who come to the United States are more likely to formula feed because they think that's what Americans do and that's what's best, even though where they're from, breastfeeding is the norm. Here in the US, it's kind of stigmatized if you breastfeed your child past 1, when overseas, like the World Health Organization recommends breastfeeding your baby as long as mom and baby would like to. Many people, other places, nurse past 2 years old and older. I know that I have gotten a lot of flack, and I still do sometimes, from individuals because I breastfed my child until she was 5. So some places and some people I know, the joke is, are you still breastfeeding her when she's 7? And it's like, no, I'm not. At a point, your child will wean. You're creating those bondings and those safe attachments with you and your child, and they're not going to nurse forever. I think many people believe that, but that is not true. As they grow in social developments, they have friends, they do different things. So a lot of other places, that is the norm, to just breastfeed your baby as long as mom and baby. And there's so many benefits from that, what they call extended nursing.
Yeah, I love that because yes, it's just amazing how people who don't understand will want you to feel uncomfortable about something that really is natural. We when we see a cow feeding his calf, we don't say but yet we think it's okay for us to now drink the cow's milk or powdered something when we are created for something that is just so natural. So I like having the conversation to just kind of change the narrative for somebody else out there who you may be having a baby for the first time, maybe thinking about it. Make sure you find a community. There are many online resources to help you do that. Um, Rebekah, her little one's lactation is one that she is excited about partnering with others. I know you've touched base with many women who are becoming more midwife in our culture, who are being doulas to help women as well. So talk about some other options that moms can partner with if they choose to go traditional way with a regular doctor, or if they decide to do some other way or have some other supporting services when they're expecting.
Okay. Before I answer you, Mommy, I'm going to answer Donna's question so that way then I can segue into yours. So she was bringing up the issue about saggy breasts. So what many women believe that breastfeeding causes your breasts to become saggy, but in reality, pregnancy is the reason why your breasts become saggy. So any woman that becomes pregnant, your body releases hormones and to help with stretching so that you're able to stretch in order to deliver, whereas your pelvis widens. So it releases all these things to help loosen. It loosens ligaments, things like that, which affects your breast. Some women are more prone to saggy breasts than others, and then so it has a thing to do with genetics, and it has to do with that hormone that's released during pregnancy to help with preparing you for childbirth attributes to saggy breast. It has nothing to do with breastfeeding, has to do mainly with that hormone and helping to prepare you for delivery. So that is one of the biggest misconceptions, that people think, oh, if I breastfeed, my breast will become saggy. That if you're pregnant, you're likely to have saggy breasts just because of that hormone. And depending on the genetics of your family members, they may be saggier than other people who have babies. So it just depends on. So it has nothing to do in relation to breastfeeding. And along with what you were addressing too, for women who are looking to give birth, they have many different options. Certain states allow you to see a CPM, which is a certified practicing midwife. You can see a certified nurse midwife, which is a CNM, or you can see an OBGYN who delivers as well. They are all great options. Depending on what your plans are and what you're wanting to do, you definitely can do research and find out whether they're going to meet the needs for you as a patient for what your requests are. If you're looking for someone who's going to be supportive of you, talking with them, advocating for yourself, because you as a consumer have the right to receive the best care that you would like. So asking the right questions, getting a second opinion if needed. And if you feel like your provider is not happy about you getting a second opinion, they're probably not the one for you. And definitely looking for options. There is not one, there are multiple different providers, and depending on what you need, you can see that person who's going to meet your needs, respect you as a person, be the person who's going to give you the care you want. If you want a medicated birth, unmedicated birth, depending on what you're looking for, asking those questions from them ahead of time so you know what kind of provider you have, seeing another opinion, finding out, asking for that, speaking up for yourself. Because a lot of times you, as the patient, the client, consumer, are going to be your best advocate. So becoming informed on that topic, doing the research, getting resources. Many people may use a doula, which is someone who can assist moms throughout, prior to delivery and during delivery, after delivery. They work in many different roles to help you and guide you, and definitely addressing different questions you may have. They're great educators, advocators, things like that, insights as a doula that may help you and your partner through this journey as you are going into parenthood. So that is a great resource for those. You have different types of educators in regarding childbirth. So those are great insights. But I always say, speak up for yourself. Many people feel intimidated, and you want to make sure you're speaking up for yourself. And if you feel like your provider isn't respecting that, you may need to look for another one, because that's not you being any way disrespectful to them. That's you respecting them as a provider and trying to get information, because the only way you can learn is getting information. And the only way you can find out whether they're going to be the best person to be on your team to parenthood is asking these questions. If they're not feeling willing to answer them, that gives you clarification on their goals and plans in regards to you.
I love that because again, it's speaking up. Because so often we get paralyzed and think, well, oh, they should know what to do. But again, for them, they may just think that this is something you have to do. And it's not necessarily the case because this has nothing to do with giving birth. But I love the one time with my daughter, I had to get a colonoscopy. And I remember talking to Rebekah and asking her about that because they said, oh, you're going to need to have anesthesia to do this. And I said to her, do I really need to have anesthesia? And my daughter said, no, you don't have to have anesthesia. So fortunately, Rebekah was with me when I went. And so when I told the person who was signing me up, registering me, and I said, you know what, I don't want to have anesthesia. And they were like, oh no, you have to have it. And so I turned around or I called her and I said, they said I have to have it. And she said, no, that's not true. And so the lady got up with an attitude and went to ask someone to say if that was the case. And then she came back and said, well, you can, but you have to sign such and such and such. But I remember I was so glad that Rebekah was there as to inform me and to support my decision because I didn't think I would need to have anesthesia for a colonoscopy. I know it's going to be slightly uncomfortable, but in this day and age, people make it sound like any kind of pain is horrible. But I'm like, it really wasn't that big a deal getting this colonoscopy without anesthesia. It was a little bit uncomfortable. I sat up. The doctor was like, oh, you're awake. I'm like, you didn't want anesthesia? She said, well, I said, no. She said, well, if you start fidgeting or get uncomfortable, we're going to have to stop. I said, I'm going to be fine. And so we did it. So with this, I share that story because so often people are going to tell you what you should have, but it doesn't necessarily mean that you have to have it. Speaking up, knowing what your rights are, so that you can advocate for yourself. And I want to go back to the comment and the question that Donna talked about with the saggy bosoms. And I liked what you said earlier, how people tend to sexualize the female now. And so therefore, we have done a disservice as women when we think that, oh, gray isn't beautiful, that our bodies, as it changes shapes and sizes as we become mothers, And it's just the natural effect of that. We don't say that when we see another mammal or animal who's fed their child and their bosoms are a little bit saggy. It is how life should be if we should have it. But yet, because they're sexualized females, they make it think that we're supposed to be perky all the way until death. And so you have so many women doing all sorts of things for that. But okay, let's get back to some of the questions here. So Tabitha is asking, what do you do when provider is disrespectful and doesn't listen and you have paid? Any feedback on that, Rebekah?
So a lot of times, depending on the situation, regarding like if it's a copay, you most likely probably will not be able to get that money back. But if you feel that your provider has been disrespectful for you and it's not listening, you want to look for an alternative provider to help with getting you the care that you need and not investing any more money in regards to that provider that is disrespectful and not listening to your needs. You can also speak politely to them when you're referring to them if they're not addressing what you need, and letting them know that you would like them to make note that they are not willing to do what you've requested in your chart. So that way it's documented that you have spoken up, saying that you may have asked for a test, you may have asked for something in regards to your care, so that they're documenting that they are not willing to do this test X, Y, and Z in regards to your care, or not allow you to do this thing because they do not want to allow you to. That they're making note of your concerns. They may not choose to, but looking for an alternative provider so that way you're not paying more into it, depending on if you paid for like delivery services. Sometimes you pay a lump sum ahead of time. You may be able to get that money back. You may have to go through legal avenues. There are different stories I've heard where certain providers have let their patients go. Talking and networking with other people, because some people may know a provider that will be willing to take you through your needs and things along that line, and you may have to go the civil route in regards to getting your money back and addressing that, depending on how the situation is handled. So
And
even if they're disrespectful and don't listen, you want to be respectful and make sure your point is heard. Yes, yes, Carla.
And I think one of the things too is just like how we shop around and get second opinions for different things. It's okay to shop around and get a second opinion for a provider. To ask somebody else, how was your experience with this particular person, and seeing if it's along the same kind of birth plan that you want to do, because we need to have a say in that. What do you want your birth plan to look like? And then finding out how that is going to look. Now, Donna had one, how to toughen up your nipples and how to dry up breast milk without pills. Can you speak to that?
So, with toughen up your nipples, that's one other myth. You don't necessarily need to toughen up your nipples. If you're finding discomfort with breastfeeding, a lot of that may be attributing to your latch. So, you want to make sure we're looking at the latch, that your baby's latching comfortably, because when they're latching, their baby's going to pull your nipple back to, if you stick your tongue to the back of your mouth, that soft palate. So a lot of times when people have uncomfortable or painfulness, your baby just has their nipple towards the front of their mouth in that hard palate, which makes it feel uncomfortable and can cause damage. So you want to make sure that your baby is getting a deep latch to prevent that damage and trauma to your nipples. So you don't necessarily have to toughen it up. I know that back in the day they used to have pills, but those pills were known to have very horrible side effects. So technically, there is no way to dry up breast milk at all at this time. So the biggest thing for people who are trying to dry up breast milk is you want to, depending on what you're doing, you're going to have to, if you choose not to breastfeed at all, they recommend you can put cabbage leaves in the freezer to put in your bra to help. Cold helps. They recommend not putting direct heat on your breast because that will draw milk to your breast and make you feel full and engorged. And then if you are engorged and uncomfortable, you can hand express or release a small amount of milk. You do not want to empty your breast, because that sends feedbacks to your body to produce more milk. So if you just release in a little bit, your body sends signals that you need to make less milk, and slowly over time, you will slowly make less milk and dry up. It does take time. Many people believe you dry up overnight, but it takes a little while for you to dry up, just like it takes a little while to establish your milk supply. And it takes a while for you to dry up that breast milk. So, depending on what type of breastfeeding you're doing or whether you're not breastfeeding, you want to attempt to um, slowly work your way down with pumping, with nursing to help prevent that engorgement.
And I love when you said that a person about the latching on, because I know one of the myths that I had is just the nipple gives you milk when you're breastfeeding, when it's the whole areola. So that whole part when the baby is latching on, getting a very nice mouthful to get that whole part in, and therefore you don't feel all of that rubbing on just the nipple part, because it's that whole part that the mammary glands are there, and the baby's able to nurse as well too. So thank you everybody for the great conversations, all that questions and knowledge and support that you're giving us for this time. So now we have about 15 more minutes that we're going to be winding down. So are there any main points that I forgot to ask you, Rebekah, that you think it's something important that mom to be or well, before we go to that, I know sometimes you've had stories where there's been a lot of uh, uh, stressful situations when you have partners or parents or in-laws who may be there during the birthing time and they're not supportive. How can a mother advocate for herself if she doesn't want certain people to be there during her birthing time? What's a good way, if any, for that?
So, different things depending on what's going on with your personal situation. You want to try to talk about those things before you get to the birthing situation to try to have time to address those situations. Depending on whether it's your family members or your partners, depending on, you may have to address it differently. Being if it's your partners, you may have to address with your partner so your partner can address their family members, depending on what your level of relationship with them is, and you're comfortable, how comfortable you are with them, will determine how you communicate with them, if you want them or not, do not want them in your birth. So a lot of times it's speaking up. Sometimes it may hurt people's feelings. And in regards to being at the hospital, you do have, I work as a nurse as well, so you can talk to your staff. There are many a time where we'll ask people to step out the room to do different procedures, whether it's to check you, get your epidural. If you choose to get an epidural, there's many different points in time where you will have that point where you are alone without other family members. And if you really don't want someone to be there and you don't want to hurt their feelings, you can use them as your resource and talk to them. They can be the bad guy for you because they are temporarily, and we understand family relationships are, in a sense, somewhat forever for some. So you can use them to say, oh no, you can't come in because we understand this time and you want to help be supportive. So use your resources if you have to do it then.
And one more thing, because
Yes.
a thought came to me that we've talked about before, when you've had different women speak to you, they may have had a C-section for their first birth, but now for that second birth, they want to try to go natural, and they've gotten pushback from their providers. Is it possible? Is it true that you can or you cannot have a vaginal delivery after you've had a C-section?
Depending on how your C-section was done, you it just depends on how your C-section was done. If it wasn't done like an emergency way, and they did not cut your uterus horizontal, most of the time you can do a VBAC. There are different factors that attribute into a vaginal birth after a C-section, And if that is something you're looking into, you definitely want to find a provider that is supportive and communicate that to them early on. So that way you can find a provider that is supportive, because it is possible, but you want a provider that is supportive of you. You do have some facilities that don't allow feedbacks or different things like that, but that does not impede your right to say no. You do have the right to refuse. You do not have to have a procedure against your will. You can say no if you do not want to, different things like that. So do not feel, if you get yourself in a situation and that was not the plan and they're like, oh, well, this is this, you have to sign this. You do not have to. You can say no. You are your advocate. You can speak up for yourself. So the biggest thing is, that there are options. So you definitely want to look for support groups for VBACs. They do have, a VBAC Facts website that has great information on being ways for having a VBAC, communicating with people that you may not know that have had VBACs and their providers. So that way you can find a provider that is going to be supportive. In some states, they do limit VBACs to OBGYNs outside of, CPMs or certified nurse midwives. So you want to make sure you're looking at where you're delivering at. Different states have different laws in effect. So doing your research, finding support. So that way, if you would like to have a VBAC, being successful. Because if you have a provider who's going to put restrictions on you, most likely they're not a provider that's supportive of VBACs. If they're telling you
Okay.
that early on, get more information.
I love
Yes,
that.
Carla?
So now, as we're winding down, that new mom, she has her baby at home. She's feeling overwhelming. What kind of words that you share for her so that she could enjoy the journey and release some of that stress, as a new mom now, and you have this little one that you realize you're responsible for? What were some of the things you did to help you to de-stress, relax during that process, so that you could still enjoy the moment of being a mom?
One of the biggest things is you cannot be a superhero. So know that none of us are perfect. None of us are perfect. I can speak for myself that I wanted to do everything myself. I was determined that I was going to do it and it's going to go this way. Asking for help when you need help, knowing how to help you. So, doing research, things like that, to have people to advocate for you, support, communicating things for what you may need during that time after birth. So whether you being specific on those needs that you need from people. So whether or not it's you can handle taking care of your baby, you may need somebody to just wash the clothes. Communicating with those who you feel are going to be in your immediate circle to help you with the things to help make your journey be successful as you're becoming a new mom or having another baby, different things. So speaking up for yourself, and if you get to a point where you do feel overwhelmed and you just don't know how to meet your baby's needs, you can always put them in their bassinet, their crib, where you know they're safe. And that way you can just go take a minute, whether you have to go in the bathroom, calm down, just breathe, and just take a few minutes to recompose yourself so that way you can continue on. Sometimes you do have to take that minute and your baby may cry, but taking that few minutes to compose yourself so that way you can continue on. It is a hard journey. And as many people say, it does take a village. So having a support system helps.
Now, we don't have time to talk about postpartum depression, but that is something that moms need to be aware of and definitely look for help if they feel that way, correct?
Yes. Yes. You definitely want to seek help and things like that. And speaking to someone to seek help. There are many different options. And most likely after this talk, I will post under here different links that you can go to for different resources. Because sometimes, as physicians, or depending on who your provider is, some providers are more able to, you see them more often and they're there for you and able to help you in those ways. But in all honesty, A lot of them, that is not their area of expertise or their specialty. So sometimes you may have to seek help through other means. With midwives, it's a little bit more of a personal feel. Some of them who people see in their home have home births. You have that where they see you more often, and you may have that person who's able to see the signs and address that with you. Whereas as OBGYNs or physician providers or ones that practice out of an office, a lot of times see postpartum mom until 6 weeks.
Mm-hmm.
Or if you had a C-section, they may say you 2 weeks off afterwards, and you may be having issues prior to that. So different resources that can help you with that postpartum depression to address that and help you navigate that, because it does require seeking help and someone helping you through those issues.
Okay. I thank you so much, Rebecca, for sharing that. So I know, guys, we covered a whole bunch of things in the last 55 minutes, and I thank you for staying tuned in. But if you know a mom or a parent who's feeling they need some questions about different things, feel free to just share this broadcast with them so that they will know how to what to do. So now, Rebecca, can you share with them how they could connect with you via the social medias, please?
I have a Facebook page that's called Little Ones Lactation Services. You can send messages, communicate through that avenue to in response to getting towards me to addressing questions or concerns or getting help you may need, and also referring you to a person that can help you. I also have a Instagram page that's called Little Ones Lactation. If you do email, you can email me at littleoneslactation@gmail.com. So that way, depending on what your needs are, connecting you with the person that can best see what you need and involves with whether you need a doula, giving you a wide variety of ways to connect with a doula, depending on where you are located throughout the US or even throughout the world, helping you reach that person, helping you with lactation support, whether you need it locally, somewhere near you. Different places have support groups. So there's different things that you can network with. La Leche League is a great avenue, and they usually do support groups throughout everywhere. And you can find one that's near you, and locally they have web pages. So there's different ways, whether you have questions about C-sections, they have ICANN that has different information about C-sections. They're great advocates in regards to childbirth and different ways to help you, and they speak up on different issues and the aspect of birthing parents.
Oh, wow. Thank you so much, Rebecca, for that. So, again, you can follow her or find her on Facebook and Instagram. Facebook and Instagram, Little Ones Lactations. And I'm excited about this new venture that she is embarking upon, because I know she's just so passionate, because we see a need. We see communities. We see that these things are needed, even though on one of the shows that my daughter and I look at on TLC 90 Day, I saw that the one people, they were actually breastfeeding their babies at the pool. I'm like, well, look at them,
They all three of them sisters.
you know, and so I want to see more brown and black mamas feeling comfortable nursing their children as well too. But if you have to bottle feed, we understand. We're not trying to say, right or wrong. This is not what we're trying to do. But we just want to encourage you to be able to have that bonding time with your children that is just so uniquely special if you're able to do that. So we're going to wrap up, and I'm going to let you know for next weekend. It's 4th of July weekend, so we won't have a conversation with Carla next weekend, but I'm excited that in August, I'm going to actually try to have a conversation with my dad and my mom, and have you guys get to tune in and listen to a conversation. So I don't have anything firm yet, but in July, I'm hoping to have that, but I'll definitely post it on my Facebook and on my Instagram page to let you guys know that, because I think they have a wealth of knowledge that we can definitely share, especially with my father, how he just has kept a balanced life, with stress and everything of life, just keeping it balanced. That I think he can share some wonderful tips with us. So, my name is Carla. I'm your relationship doula, helping men and women bravely birth peace in the pieces of their lives. And so I want to thank all of you for tuning in on this Sunday. Enjoy the rest of your day, and stay safe wherever you are. Practice whatever social distancing that's required so that you can stay healthy and manage your stress. If you need to reach out to me to help you learn how to manage some of those stressful issues, please feel free to do so. You can click on there and set it a complimentary appointment so that we could connect. Thank you all and have a great day.